The rotator cuff is a very common problem that I see in the clinic. The rotator cuff are a group of 4 tendons that attach to the side of your shoulder. The rotator cuff's job is to elevate your shoulder overhead. Many times patients may experience pain in the outside of the shoulder, pain with overhead motion, and pain especially at night when they have irritation or injury to the rotator cuff. Most common injuries to the rotator cuff actually happen to be not injuries at all. It's a degenerative condition that may occur over time. The older you are, the more likely you are to have tearing or injury to the rotator cuff. In certain young athletes, you may have injury to the rotator cuff with certain throwing activities or injury that occurs during the field of play. In the older athlete, many times you will not even recognize a particular injury, but will notice pain that will begin and continue over time. In the office, we will perform a physical exam and take an x-ray to evaluate the status of the rotator cuff. Often, however, an MRI is needed, which is a special test that looks at the integrity of the rotator cuff tendons. Treatment for rotator cuff injury or pain depends on the severity of the injury. If injuries to the tendon are just inflammation and small, low-grade partial tearing of the tendon, we will begin a simple non-operative program. This includes physical therapy, which is critical to recovery, anti-inflammatories, and/or injections. If patients do not respond over a period of 3 to 4 months with this simple treatment, some patients may elect to undergo surgery for this kind of problem. In patients with complete or full thickness tears, meaning the tendon is torn away from the bone, that often is a surgical problem. Fortunately, we have simple, minimally invasive ways to treat rotator cuff tendon tears. This includes arthroscopic surgery, where we make small incisions around the shoulder to use a camera and instruments to pair the rotator cuff back to the bone. Although the success rates for rotator cuff repair are excellent, over 90% good to excellent results, the recovery can be slow and tedious. Recovery can take up to 6 months. If you have shoulder pain that was sustained either at an injury or that just won't go away, it should be evaluated by an orthopedist in the office.